We'll stay with the same springs for this demonstration. Pelvis rolled under, navel pulled in, shoulder blades down, long neck. I'm going to remove my foot. You ready? Exhale out. Inhale in. So with this exercise, the distance that you have them put their foot out and how light you place the springs really affects how hard their adductors are going to be working to pull that carriage back in. So be conservative, don't make the springs too light, and don't have them put their foot too far out initially. Again, she's on a red and a yellow. A progression would be 1 blue. Great. Okay, now bend both knees for me, please. See, I'm holding this to make sure she gets her positioning. All right, and here we go. You ready? Okay, out. Exhale out. Nice demonstration of traveling equally. Again, staying stationary on the foot plate leg and moving only the left leg. Go ahead and demo that, please, Elizabeth. That's a good exercise, too. That's more of a progression. You can see how it's a little bit more difficult to keep the pelvis level, etc. Good. Go back to the other, please. Traveling equally. Nicely done. Sternum staying lifted. Navel, definitely pull it in to support the spine. Okay, and rest. All right, so my foot goes back up to support the carriage. She is going to hold my forearms. I have her elbows. Pull your foot in, please. Get them narrow first. And scoot to the front. And now step off with your left. Good.
If you'll notice, I've been wearing these shorts throughout our videos. These are Opedix Core Tech shorts. Great shorts for the stability of your core and muscle function. I feel less fatigue in the hip and lower back area. The banding is great because it supports you in the right manner. For more information about how to get a hold of these shorts, see us at the end of the video.
The first exercise we're going to do is called a quad set. Elizabeth is in position for the quad set. Her non-involved leg is bent with her foot near the opposing knee. This is her involved left leg. And what I'd like for you to do, Elizabeth, is to set this quadricep muscle. The way you're going to do that is by pressing the back of your knee into the mat and pulling your toes towards your face. Notice how her heels lift up off the mat, and you can see this muscle contract or set. Hold for a 2 count and then relax. When you relax, let your foot relax as well. Good. Do several more for me while I say this exercise can be done either in sitting, which is more difficult than lying down. Elizabeth's sitting for the purpose of demonstration. Super. The next exercise is called a heel dig. Elizabeth is already in position for this exercise. Notice the degree of bend she has in her knee is limiting the degree of bend she has in her hip. So we're protecting this hip joint that was just operated on. All right, so please keep your heel in the mat. Pull your foot up towards your face. Good. Flexing your foot. Now what I'd like for you to do is dig your heel down into the mat like you're trying to leave an impression of your heel in the mat. Feel this muscle group contract. And then rest after you hold a 2 count. Good. And dig again. This is contracting your hamstrings. And relax. And one more time. And relax. This also can be done lying down or sitting up. Okay, knee flexion, hip extension. So Elizabeth has her forehead resting on her forearms, pulling her navel up to the back of her spine as if she's lying on a hot plate. Pull that tummy up and in. Seat tight. And now, Elizabeth, with your involved leg, bring your heel towards your bottom to increase knee flexion and relax. This is good for both total hips, repeat, keep going, and total knees. Great, trying to pull your heel into your bottom as far as you can, and extending. After the next one, rest for me, please. And now lifting from your seat, the back of your thighs and your seat. Keep leg straight, lift it up high enough to clear the knee off the mat, and rest. So she lifts with a pointed foot, which is fine, and rest. She can also lift, flex her foot, point it when she rests. Both work. Keeping the knee straight, building the glutes and strengthening the hamstrings. Rest. All right, Elizabeth, please hold the handles. And now place your left foot in the strap. Great. Your right foot, flex your foot as if you're standing on it. Keep this muscle taut. And now pull this leg up using the handles until you feel stretch on the back of your leg. Of course, avoiding 90-degree angle. And now notice how she has her hands on the handles, fingers through the loops. That's fine. You can also reach up and hold these purple plastic knobs that are easy to hold on arthritic hands, and they can help you measure your progress as far as how high up you can reach, and that intensifies the stretch for you, does it? Yes. With your arms extended, as opposed to go back to holding the loops or the handles with your arms bent and supported on the mat. Okay? All right, and now ever so slightly and gently allow this leg to go out to the side just a little bit to stretch the inner thigh. All right, come on up. Of course, we're showing stretches for a total hip replacement. If she was a total knee replacement, she could go across her body. As a total hip replacement, we only go up and slightly out. We do not go across the body for a total hip. And rest. Flamingo stretch to stretch the front of the thighs. All right, Elizabeth, I'm going to put this around your ankle on your involved side. I'd like for you to hold the handles. Great. Now put your knees together like a flamingo would do and pull your heel up towards your bottom, keeping your chest up, your navel pulled into the back of your spine, and pulling your heel towards your seat. Now, of course, no issues here, and she has great range of motion. We would not be expecting this until down the road post-operatively. Hold 10 to 15, 20, 30 seconds, increasing your tolerance to the hold of the stretch. And rest. Next is runner's stretch. Using a stationary support, please step back with your involved leg, reaching back, making sure that you place your foot straight, bend this front knee, bear the majority of your weight on your front leg, stretching your back hamstring and calf, keeping your heel down on the floor, pressing your pelvis forward, pulling your navel into the back of your spine, putting your shoulder blades into your back pocket, keeping a nice long neck. All right, hold that for 20 to 30 seconds, feeling the stretch. Monitoring them to make sure their heel is on the floor, their foot is straight, knee straight, pelvis is pressed forward. Great, and relax. Step forward, and now do the other side. So again, the involved leg works in both positions. The first example, it was doing the stretching. Here, it's doing the majority of the weight bearing and stabilizing. And return.
You've seen all of our props that we've used throughout the video, and we would like to share them with you. So go to our website, abundance.com. It's ab, A-B, bun, B-U-N, and dance, D-A-N-C,